And I'm just going to go through a few housekeeping rules to start with. So this is a formal council committee meeting, and the proceedings will take place live on the internet. The meeting will be recorded as well for future viewing, and it will assist the conduct of business if participants speak when invited, and that will either be through your little hand raise button, although I've had problems with that in the past. So if you want to just put your picture on and put your thumb up or wave at me, then I can come to you in turn. Can all participants please mute their microphones and turn off the video feed when they're not speaking? Members of the public are welcome to view the proceedings, but should not make contributions at this meeting, so we don't have the public forum as we have done in the past. Please remember to unmute your microphone and switch on your video feed when it is your turn to speak. Speak clearly and slowly into your microphone. Anybody wishing to speak, as I've said, indicate with the raise your hand icon, or just wave at me. Make sure that don't miss an opportunity. Just wave at me, and I'll get to you. I ask for everybody's patience. I think, as Helen's pointed out, today there's been some glitches with the technology. I do apologise in advance if we experience any unforeseen difficulties, which we shall try to resolve. But I know next to nothing about IT, so we'll leave it to those guys. So I'll now move on to the agenda item. So agenda item 1, which is apologies for any absence. Kim?
There are none, Chair.
Right, okay.
Connect to the meeting. He's waiting to connect, but he can't connect.
Anne, Parmagit's trying to get into the meeting and can't connect. He's just rung here to say.
Right.
So is there somebody there from IT that's can assist?
No, Helen Shepherd is helping me from Democratic Services. Helen, would you mind sending him the link again?
Will do. I'll send him the link, and then I'll give him a call if not.
Thank you, Helen. Thank you.
Thank you.
Okay. Appointment for any substitute members, Kim?
No, there are none, Chair.
None. Declarations of interest under the Members' Code of Conduct. No.
Chair.
Councillor Bevan. Councillor Bevan, you're on mute.
You're on mute, mate.
Still on mute, Councillor Bevan. Oh, that's it.
You're Ian.
Can you hear me now?
Yeah.
Yes.
Yeah. Chair, I'm employed by the Dudley Group of Hospitals at Russell's Hall. As referred to later on in the agenda.
Right, okay. I'm not sure because Parmagit hasn't come in yet, but doesn't he usually declare an interest because of his wife's work with children?
As a social worker, yes.
Yeah, okay. So I think we need to record that.
Okay.
Right, agenda item 4 is to confirm the minutes of the meeting held on the 29th of June 2020. Does everybody agree that I can sign those minutes and that they are correct record?
Agreed.
Yeah. Okay, I'll virtually sign. Right, agenda item 5, Children's Services update, and we've got Helen to give that for us. So I'll turn myself off now. Okay, Helen, over to you.
Okay, thank you, Chair. So what I'm going to do is just give you an update in terms of where we're at within Children's Services. The past couple of months, I suppose, since I came into the acting role, one of my objectives is to secure a permanent leadership team within Children's Services. You'll all be aware that we didn't appoint to the DCS, and I know the Chief Exec and the Cabinet member are currently working on that position at the moment. We appointed the Assistant Director, Andrea Stone, for Children's Social Care, and Andrea is actually on the call today. So if Andrea could just put a camera on and just introduce herself, just so everybody knows who Andrea is. I think you're on mute, Andrea. Sorry.
I say that to so many people all day, so I'm surprised I've done that. I'm Andrea Stone and I'm acting Assistant Director for Social Care. I have been in Dudley for a year, though previously my role as Head of Safeguarding, so I'm quite familiar with Dudley, so pleased to meet you all today.
Hello there, Andrea.
Hi.
Okay, we've got the head of safeguarding and head of children in care position that's currently out to advert, and we'll be working hard to ensure that we recruit a permanent and experienced manager in those positions. So that's our priority at the moment, is to secure that leadership team. You'll all know that we've been working really, really hard over the summer and pre the summer around school preparation. And we've got a paper later on in the agenda that talks about the summer provision and September update. But just to give Scrutiny members an update in terms of where we're at for this week, all of our schools in the borough are open, and we're currently on something like 92% attendance. So from a borough perspective, that's an absolutely really good result for us. We'll continue to monitor the attendance, and we'll continue to support schools. There's lots of issues, lots of challenges, lots of teething problems, as you can imagine, with the COVID restrictions and with kind of adhering to those, working with parents and carers. But we as an LA have been very supportive of schools, and will continue to do that. But I won't steal Jeremy's thunder anymore, because Jeremy, the lead for education, will describe that in a bit more detail later on in the agenda. The other area of focus has been children's social care for me. I'm in the throes of securing that improvement plan, and ensuring that all the improvements are recorded accurately in that plan. And that's something I've particularly wanted to address as a new acting DCS. And within that, just for Scrutiny's information, is that we've commissioned an ex-HMI inspector to come into children's social care and do a sense check for us. Gary Lamb is the ex-HMI. He's in his last week with us now. We've had ongoing feedback from Gary, and we'll have our final feedback on Friday, and I will report that feedback into the improvement plan and ensure that that's presented at some stage here as well. The other area of focus, and that continues, is our SEND improvement journey. So despite COVID, we've continued to work hard to ensure that that improvement journey continues. Still lots of challenges, as you can imagine, and particularly going back into school for our children with disabilities, that is a challenge for us. But we continue to work really hard with parents and carers in our special schools to ensure as many of our children with disability children are back in school. So in essence, that's just a quick summary of where we're at with children's. I'm not sure whether anybody's got any questions for me at this stage.
Sorry, it's all right. I pressed the wrong button, so I didn't know where I was going. Thank you for that, Helen. I think there's some people waiting to join in the lobby. Is that right, Kim?
Chair, it's Helen. No,
Oh,
there's
right.
nobody. There's nobody in the lobby, but there is some people that got their hands raised. We've got Councillor Bevan and also Councillor Ridney.
Yeah, I don't know whether Ian's was left on from before.
Okay.
May have been, but can I
Yeah,
go to
it's come off. Yeah,
right.
it is. Yeah.
Councillor, right. Can I just say, welcome, Palmjit. Excuse me. Can you? You're on mute, but if you're not speaking, can you turn off your camera feed, please? That's it. Thanks, Sue.
Thanks, Anne. Just to say, thanks for the update, Helen. Very good, and it's good to hear that we've got that 92% attendance across the borough in the schools, because that was something we were really holding our breath on, wasn't it? I don't think anybody had any idea what sort of number you could have plucked any figure out of the.
Absolutely.
So that's good. That's good. Let's hope that we can get that to rise as the weeks go by. But I do recognise that there will be some that can't due to other issues that I will still have to shield. Thanks.
Absolutely. Thank you.
Thank you, Sue. Yeah, I'd like to add my thanks as well, Helen, for that report, because I'm very much aware, you know, of how much support we as an LEA have given to the schools, and we've worked really hard with them. And I know that your meetings with the heads from the different townships has been very, very, you know, proactive. So the fact that we've got 92% take up is very, very, very good. So, you know, well done, and congratulations to all the teams who have worked so hard to get us to this position.
Thank you, thank you. And as I said, that will fluctuate throughout the weeks, dependent on children being in and out. But we've started off in a positive note, so that's reassuring.
Right, that's lovely. Thank you very much indeed. Right, so everybody's aware of the update given by Helen. If we can move on now to agenda item 6, which is the Children's Services Complaints Response Times Action Plan, and that's going to be presented by Darren Pickling. So welcome, Darren.
Hello, good evening all. Members will remember that at the last meeting we presented the annual report, which showed that the response times to complaints had really taken a dip down to around 41%, and members requested that we come back with an action plan that set out how we could try and improve these response times. So just to feedback, I mean, following, we looked at what our processes were and what we may be able to do, and following extensive consultation with senior managers and also with our ICT services, the revised process that's shown in Appendix A to the report was recently approved by DMT and circulated to all staff on the 18th of August. To go through the key changes, what we brought in is that right from the initial referral now, managers who are responsible for responding to the complaints are fully aware that they will be required to provide an explanation as to why a response was late. And I know that was something that the members was particularly keen to know, because we hadn't got that data. We couldn't explain the exact reasons why. We knew responses was late, but we couldn't explain the reasons why. So right from the very beginning, you know, the managers are now aware they will have to provide a response. Right as well from the very beginning, service managers will be copied into those referrals, so they also are aware directly from the data a complaint comes in that of all the complaints that are in their area of responsibility. So they're able also to check and track the progress of these complaints and progress chase them themselves, which really supplements and complements the work that the complaints team do, that my team does as a matter of course anyway. What we've also done is we've built in an additional reminder. So whereas we used to send a reminder maybe 3 working days before the due date to say to managers, look, this is just a bit of a nudge that this response is due, we've built in one a few days before that, again copying in senior managers so that they're aware at an earlier date that this response date is approaching. As I say, this new process, it does make sure that senior managers and heads of service are fully aware of all the complaints in their area, they're aware of the approaching due dates, or indeed those that have exceeded the target dates. So really there's an expectation on those managers now to assist my team and my staff to really make sure and proactively make sure that these responses, as far as possible, as many are responded to on time. Just going back to the ICT services and that, we've made some amendments to our system now that will now allow us to actually gather the data and the information for managers to explain why a response was late. So we've started gathering that data. We've managed to put the changes on our ICT system. And in the appendix, it gives the reasons which we can add to as this progresses along. And what we've started to do is gather the reasons for this, and we're going right the way back to the 1st of April. So right the way back to the beginning of the period after the last annual report. We've already circulated the first report a week or so ago. So managers are now in the process of coming back to us with the reasons as to why all of the late responses in this financial year have been late. So we'll be able to report that back to a future meeting, which will give us an idea as to some of the reasons as to why the responses, if they are continuing to be late, they are late. So hopefully that just outlines the measures and the action plan that we've took. It has recently only just been implemented after we've done the extensive work to see which was the best way forward. We'll probably see that we're in the middle of the second quarter now, so really we would be hoping to see some kind of improvement now, but really it's going to be the third quarter when we'll get a real view as to what these impact of these changes have had on the response times. So I don't know whether Helen or Andrea wanted to add anything, but that basically outlines the action plan that we've now put in place and the steps we've took in place to try and improve these performance figures.
Yeah, thanks, Darren. I think it would be good if Andrea could just come in terms of just offering Scrutiny that reassurance, Andrea, from a children's social care perspective, please.
I can do that. So yes, so I've been made aware by Darren and Helen about the issues that we've had previously around complaints, and have had quite a lot of oversight on that. So I'm really clear with heads of service and service managers now about the expectations of not just having a reason for why they're late, but in the first place, was trying to get them done in time. So I am copying as some of those, and I've also I'm going to set up a monthly panel, a meeting with me for complaints that have gone out of time. So we are really trying to have a structure that just sets a culture that we don't have complaints going out of time. And occasionally they have to, but there'll be a good reason for that, and managers can explain why that's happening. So certainly it's been elevated. There's more of a conversations around that, and people are expecting that they have to respond or to provide a reason for why they haven't done so. So I am confident that we'll see some improvements in this area.
Right, thank you, Andrea, and thank you, Darren. Before I go on to any other questions, because I believe Councillor Sahota's got his hand up, I want to just ask a few questions. I notice on the appendix, Darren, that we've got, your new referral, first reminder, second reminder, due date reminder, first, second, third and fourth overdue reminder. The very fact to me that we need to send 4 overdue reminders, and in essence you're looking at 7 nudges to get to where we need to get to, seems rather excessive. Why do we need 7 nudges to get to that particular place? Councillor oh no, sorry, I've got Councillor is it Councillor Ridney as well got a hand up. Councillor Parmjit Sahota, did you have your hand up? I can't hear you, you're on mute. You're on mute.
Thank you. Can you hear me now?
Yeah, we can now, yeah.
Thank you, Jess. First, apologies for joining late. I welcome the work that has been undertaken to, obviously, following the meeting last in the summer. I think my only concern, obviously, is that hopefully 2 colleagues have outlined where we're trying to get to. My only concern is, in a sense, it's really not an action plan. All we've got is a revised following up process, which should be part of a bigger action plan, which will look at where we are, where we're going to get to, how we're going to get there, what are the key targets. So really all we got in front of us is, like you said, elongated action plan. There's too many, we're giving too many reminders. So although I want to feel reassured, I feel that all we got is a revised process. It's not really an action plan. The action plan this would be a part of an action plan, which will then look at targets, are the training issues, could this be a key missing target to be a key KPI for staff and managers' appraisals on a yearly basis, periodic review. So those are the things that you would find in an action plan. All we've got is a detailed, revised, follow-up information and how we're going to monitor it. So although I feel there's quite a bit of work being done, like, for example, I think Andrea pick this up, that there's going to be monthly check. So those are the things you would have in a concise action plan, and how we're going to go forward. All we got is a revised check process, really. So that's my only concern.
Right, thank
That's
you for
really-
that. Would it be
Sorry.
better if I went to each question and then
Yeah.
you answer at the end? I think that's better. Councillor
Okay.
Ridney, please.
Thank you, Chair. My concern was, again, looking at that chart that's just been referred to, once you've gone past the due date, that's 12 working days, which actually in our local terms is 2.5 weeks before they produce an answer, which, you know, often has been the complaint from people about the length of time. So I am a little concerned. While I say well done on the work that's been done, I'm still concerned that the bottom half of that chart actually says it's some 2.5 weeks after the due date before they can expect a reply, which I think is a little long.
Can everybody mute and get off the screen unless you're talking, please? Right, Councillor Ian Bevan. Ian?
Can you hear me now?
Yes, we can, yes.
I want to echo your views, Chair. 4 overdue reminders suggests to me that we are fearing the worst and that we have an action plan in place, but it's going to take an awful lot of reminders to get there. And I'm also picking up on the action after response sheet, where managers are asked to state the reason for delay and additional information under one or more of the following. And then there's 5 headings. Can we be assured that there will be a quality response there, and it won't simply be a case of saying this is a complex case? There are multiple teams involved. We need to be looking at this and making sure, yes, it is a complex case. Yes, there are multiple teams involved. I'm just worried that officers may choose to tick the box, and that we might be back here in a couple of months' time looking at it and still working around this.
Right, thank you for that, Ian. Anybody else got any questions on this particular report? Because if not, then I'll call upon Andrea and Darren to respond. Oh, Ian, can you remove your hand? Thank you. Okay, should I hand over to Andrea and Darren? Thank you.
Shall I go first, Darren?
Yes, if you want to, yeah, and I'm happy
Okay.
to cut in as well in terms of the detail of the process, because I think we need some clarity. I need to clarify something on that in terms of the 7 reminders and that.
All right, if you do that first, and then I'll chip in if I need
Okay
to.
then. Right. If I can just say that the first 4, I know, Chair, you refer to 7 reminders. The actual first 4 parts of it are actually reminders before we get to the due date. So that's the process that we've tried to improve, to make managers, you know, fully aware and senior managers that this is the due date, this is what you're aiming for. I fully accept. I mean, I suppose where we've got 4 overdue reminders after, that's just really building in that. I suppose it's saying that we're not letting this go. You know, you've got to provide a response. It doesn't mean we'll need 4 reminders, because obviously we'll be copying in senior managers at that time. So there isn't really 7 reminders. And obviously when we talk about, I'm not quite clear where the 12.5 days after the response times comes from, because what we're looking for is that they respond on time, and if not, this is where the overdue reminders come in to try and push that along. Could I just pick up on Councillor Bevan's last point as well, Andrea, please, about
Yeah,
the
sure.
action after the response time? Yeah, just picking up on that point. Absolutely. I think just to have a tick exercise where we say, yeah, managers can put that. But my team, in conjunction with senior managers, we obviously have the detail of the complaint, and we're quite happy to quality check those responses, so that there isn't just a simple, it was complex. You know, we can use our expertise and knowledge of cases and complaints to determine whether or not it was complex and whether there was multiple teams. And if we've got any doubt, we're quite happy to challenge that and involve Andrea in that challenge if required. So, Andrea, I don't know whether you want to.
Yeah, just a couple of things. So I wanted to just respond to Councillor Sahota. So that was a really helpful comment you made in terms of the action plan. And I agree with you, there's probably more we can do, particularly if we're thinking around performance and KPIs and how in the targets within children's services. So that in particular, I'll have a look at again. We'll have a look at again with Darren just to see if we can tighten that up a little bit more. But you know, I absolutely get that you don't want to get the feeling that we're just chasing indefinitely, but we're really quite tight up until the date that a complaint response is due. And if unfortunately we do go past that we are quite heavier in terms of getting responses to that. So it is something that we accept, we recognise that we haven't been doing a good job, and this is a starter for us. So if we need to do more, then we will do more.
Thank you for that, Andrea and Darren. Yes, I think members have raised a number of concerns on this, and we will be happy to sort of appraise the ongoing situation, you know, at regular events at our committee. It also impacts on a lot of us elected members, because obviously if nobody is responding to complaints or issues, then they get in touch with us, which we then have to chase it on their behalf. So it's very, very, very important that we've revised this, and our recommendations are that the members note and approve the revised processes and actions put in place to improve complaint response times. But I would like to see a regular updates brought to this committee, if you would. Thank you. Kim, can you minute that, please?
Yes, Chair, I have done.
Right, thank you very much. Right, moving on then to agenda item 7, which is the Early Years Transformation Academy, and we've got Scott Jones to present. So welcome, Scott.
Hi, good evening, everyone. For those of you that don't know me, I'm Scott Jones. I'm acting head of Family Solutions. I've been working within Dudley Council now for just over 4 years, and I've been acting head of Family Solutions for just over 18 months now. I'm really pleased to bring you this report, so thank you for the opportunity to bring Scrutiny up to date with the work that we've done around the Early Years Transformation Academy so far. And in terms of recommendations, there is one very clear recommendation for Scrutiny today, and that is to appraise you of the work that we've done around the critical first 1001 days of a child's life growing up in Dudley, and also to give you an opportunity to offer some scrutiny around the work that's taken place so far, and also the implementation plans that still lie ahead of us. In terms of background, obviously I've completed quite an extensive report, and I know there's an awful lot of detail within the report that I've provided, but what I've wanted to do today, just appraise you of some of the salient points that I think are worthy of note in terms of discussion to make you aware of. First of all, we had this opportunity to apply and was successful in being part of the work of the Early Years Transformation Academy, working with a national think tank called the Early Intervention Foundation. We were one of 5 local authority areas that were successful in bidding for and working with the Early Intervention Foundation throughout the last financial year. So we've worked with Barking and Dagenham, Westminster, Kensington and Chelsea, which were known as Byborough, Norfolk, and also our neighbours in Sandwell in developing our Early Years Transformation Academy work. The work hasn't attracted any additional funding, as many pilots and testing does. This was more an opportunity to have the support of the Early Intervention Foundation for a 12-month period to help us develop improvements, particularly around our outcomes across maternity and early years. I think it's important to say as well that I'm representing today a number of systems leaders across maternity and early years. Although obviously I'm a council employee, there were a number of us that have been involved in this work. So from Children's Services myself, we've had education outcomes represented also. And we've had colleagues from the CCG, Dudley CVS, health visiting, maternity services, and also public health. So Balcour within the council, prior to her acting role as Director of Public Health, has been working hand in hand with me right the way through this period. What our intentions have been is to have a fundamental shift away from much of the silo working that takes place within maternity and early years. And as many of you will be aware, we've got some significant challenges around some of our maternity and early years outcomes, which I'll come to later on in this piece. What has been very evident through our last 12 months worth of work is that although many parts of the council's work was better connected across early years, our links with maternity weren't as strong, and this has given us an incredibly important opportunity to really develop and forge much stronger links with our maternity colleagues based at Russell's Hall Hospital. First of all, one of our main tasks was to really get under the skin of our needs assessment across the borough and across the systems, have a really detailed understanding of what challenges were presented to us in terms of maternity and early years outcomes, and geographically which parts of the borough were most greatly affected. So some of the areas we've been looking at are around babies that are born of low birth weight, our school readiness challenges, children who are overweight and obese at a young age, issues around smoking in pregnancy and infant mortality. Much of this information is included in the Understanding Dudley document, which is in the public domain and is linked through the council website. So very much drawing on the information that was already in the public domain, but getting down into a much more granular level of detail, particularly around wards that are most affected by some of these areas of inequality. We've also taken an important approach with particularly with our Dudley CVS partners around community engagement, and really trying to have a dialogue with residents, particularly those that have very recently experienced maternity and early years services, to get an idea from them of what's worked well and what our key areas for development should be across the maternity and early years systems. I'm really pleased that so many residents took part in that feedback, and we've had some very detailed analysis from our residents around what has worked well and what has worked less well for them. So in terms of the implementation work around the critical first 1001 days. The first 1001 days start antenatally and work through to the child's second birthday. That's what we mean by the critical first 1001 days. So we're very much focusing on the antenatal period and the experiences that that child and family has through the first 2 years of their life. That's a real area of concentration for this programme. And what we want to achieve is that every woman experiences a healthy pregnancy, that we have improved school readiness, we reduce the impact of poverty, that we empower families to make better healthy choices, and we really hear their voice, and to strengthen communities and strengthen relationships with communities and families. There's quite a detailed plan working with the other 5, or the other 4 rather, local authority areas. We all came up with very different plans, some smaller scale and some much larger scale. And what we've done in Dudley is we've been very ambitious about our intentions to improve services. Some local authorities focus on one particular aspect, such as speech and language. We've looked at a whole range of system change for our maternity in early year systems. So our plan is, first of all, around maternity services, to have a targeted community-based midwifery service. The Cochrane review, which I've referenced in point 56 in my report, highlights that a continuity of carer model, which provides a consistent midwife right the way through the community phase, antenatally, in the ward, at the delivery phase, and then post-delivery back in the community. There's a very strong evidence base that maternity outcomes are vastly improved when there is one continuous midwife working the way all the way through that period. Currently, there is a completely different and distinct team who work within Russell's Hall Hospital in terms of the delivery phase that are separate from the community midwives. So that's an important next phase for maternity services, and quite an important and challenging change around their workforce development, because they're two quite distinct teams at the moment. So that's called continuity of carer, just to reinforce that continuity of carer. At the moment, health visiting offers a very similar approach, whichever part of the borough that you live in, whichever area that you live in at the moment. And health visiting through the Early Years Transformation Academy intend to employ an increased level of contacts with families where areas are most challenged in terms of health inequality. So that's an important change for them, to have a graduated response based on areas of inequality. We also plan within the council, an area of my responsibility, to have an increased offer around parenting support, both universal and targeted within our most challenged areas. And at the moment, although our 2-year take-up for our time for twos places is above average, and what we're very aware of is that particularly during the pandemic, we may well have some challenges in some of our 2-year-olds returning to a nursery place. That's something that we need to take stock of. But also there is a mixed economy of children who are taking up 2-year places across the borough. And again, we want to make sure that where inequality is the greatest, that the uptake of the time for twos places is as close to the national average, if not above, that we can possibly get. And then finally, as part of our implementation plan, we're very aware that in some of our most disadvantaged areas, there are opportunities for community learning and parental engagement around early years from the voluntary sector is underrepresented, and we want to make sure that there is a strong platform for parents to be able to access community-led provision, which is something that we want to see developed. So in terms of our delivery, we really wanted these plans to commence, and we had our last formal planning meeting just at the start of March, just as the pandemic was starting to take hold, and we weren't clear at that stage how the pandemic would affect the implementation, particularly around maternity services, because maternity services are the springboard for the whole programme to take place. And of course, as March, April, May went on, it became much clearer that this programme wasn't going to be able to be implemented, particularly from a maternity services point of view. Many of the staff were solely focused on making sure that women were giving birth safely within Russell's Hall, and that wasn't the time for a whole system change in terms of the continuity of carer model that I've referenced. But when we do implement it during the autumn, we hope, given the pandemic and local lockdowns that we're very much hoping to avoid within the borough, the work will particularly commence from a maternity services perspective, as I said, as a springboard in the Netherton, Woodside and St Andrews ward. That's where we've identified that some of the health inequality issues that I've referenced are the most challenging, and that on that basis, that's where maternity services are very keen to test out this continuity of carer model. And following that, we will work on our health visiting, our 2-year take up, our community based resources from that point, as I've detailed in the plan. Also within that area, the CCG have noted that there is a very strong GP infrastructure linked to the health visiting service there as well. So it gives us a good opportunity to build on some of the strengths that already exist in that area. So as I said, there are some significant workforce development issues, particularly across maternity services, less so around health visiting, it's more around increased contacts. And in terms of understanding the difference this is making, we've already commenced some quite sophisticated work with our management information teams within the council and across the maternity and early years systems to really understand that the changes that we're making to the system are having the impact on infant mortality, on low birth weight, on smoking at the time of delivery, on school readiness, and all the other indicators that affect the maternity and early years system. So, as I said, very much dependent now on our maternity services in terms of triggering the implementation, and we're really waiting for them to signal the point in which we can go live with these ambitious, ambitious implementation plan. I have to say it's probably one of the most exciting programmes that I've been involved in. I've been working in children's services for at least a couple of decades now, and this has been an area that has certainly tested me out in terms of trying to understand our outcomes within Dudley and really understanding how we can make a significant impact. And I think it's a credit to the Early Intervention Foundation and their work with us as a borough, as a national organisation, to have that laser-like focus on our outcomes, and a credit to them for the work that they've done with us throughout the last 12 months. So that's what I wanted to communicate, Chair, and of course happy to take any comments and questions from this point that I can answer, representing, as I said, the other system leaders that have been contributing to this programme.
Thank you very much, Scott. There's a number of questions that I want to ask before I come to other members. In reference to it's number 41, the bullet point 41 about the aspirations for every woman experiences a healthy pregnancy, and that particular paragraph. And how is that to be delivered and achieved? Is it going to be done through family centres? And also, do we still use GP practices for the couple of afternoons a week for new families? Because my big concern is if we are only operating out of family centres, people in my ward in Gornal, which does suffer from levels of deprivation in some areas and very affluent in others, just will not access the family centre in Cosley because to them it's another country. The other thing is that when we're looking at the time for twos and the take-up being significantly lower in the most disadvantaged areas, is this because people are not aware of it? Do we need to do more work around that, promoting that? And then my final question, because when you read this report and you look at the statistics of what's been going on, it reads like a horror story, and it's wonderful that we've now got this, the early years transformation that's going to make a difference and ensure that Dudley, increases its outcomes. So my final question would be, is when do we envisage getting the data through to show any changes? Can it be done after 12 months or is it 2 years? What sort of timescale, Scott, are we looking at for to show that there's been improvements? I think the best thing to do is we will ask the questions and then you come in at the end. I think that's the best thing to do. I think I've got Councillor Ridney on the screen. Sue?
Thanks. Thanks, Scott. I have to say, I did enjoy reading your report. There were many parts of it that exactly is what I feel and what I feel goes on in my own community. I did note that there were several comments though that are obviously figures based prior to COVID, and I think perhaps we will be looking at a slightly different picture once all the data comes in and what's gone on during COVID. And I take that on board. I'm not going to ask you questions about that because you can't make guesses at that. It was quite good to see, certainly in the aspirations, and I was quite impressed with that, about community resilience. It's something that I think we do need to pay great attention to. While we as authority cannot cure the ills of deprivation by ourselves, that is for something to come nationally from government. What we can do is do something about building our community resilience, and about helping people feel better about the communities that they live in. And as you know, one of my real passions is about school readiness.
I'm very aware, absolutely.
And I think community resilience will help with that. I also note there was a comment in the report as well that often young parents don't have faith in our professionals. They go to family and to community. Well, I don't see that as a problem. I think because that's something that we've lost within our communities, is the extended family, isn't it? And the support that often young moms need. But as you know, I am also a great believer that we should have a universal offer to our parents, not just targeted, because no matter what your social background, being a parent is a very terrifying experience as a new mom. So just one of the questions I'd like to help, you make comments about smoking being a problem amongst our pregnant moms. Has anybody looked at the effects of the vaping as well? Because I feel this is a field that we are not looking at enough, how many moms are vaping rather than smoking. But I do feel there hasn't been enough research done on that. That's just my medical stuff coming back out again. But I do feel that shouldn't be ignored. And I think perhaps we, as a scrutiny committee, should also look at some of the aspirations that you've got and the outcome measures, because they're things that we can contribute towards by what we know about our own communities. So thanks very much for the report, Scott. Enjoyed reading it. Thank you.
Thank you.
Can I call on Councillor Ian Bevan, please? Ian?
Thank you, Scott. Yes, I enjoyed reading the report. There's a couple of points that I wanted to make. Paragraph 22, I picked up on quite a bold statement that mothers of offenders did not breastfeed and smoked. I was wondering what other examples we found in addition to that. And the other point that I wanted to make was at point 38, which talks about Dudley's most at-risk children and families' needs going unnoticed because they're masked by areas that have good outcomes. That's certainly something that applies to parts of my ward, and I wondered what we were going to do about that.
All right. Councillor Sahota, please.
Can you hear me?
Yeah.
I just want to echo the words of the fellow members, really, Scott, in terms of having read the report. It outlines a clear vision going forward, delivering a lot of positive change in the community for families for Dudley. And I think Anne's already picked this up in terms of tracking the changes. How long what's the lead time? We need to wait to see some. I know this kind of big project, it takes like a world tank. It will take time to change and the outputs to come. So you presume looking at for 18 to 2 years down the line. And I think the only one blemish I could find in the report was that right at the end, where under the quality impact assessment, where the last sentence where you say, if required, the quality impact assessments will be undertaken on the implementation plan. My understanding is it's not a requirement. It's not an option. It's actually a requirement, legal requirement to do EIA on any legislation or any strategy that council is going to deliver to make sure hard to reach communities or people who need support are not sort of they're inclusive to any changes. That's it really. But apart from that, really positive.
Thank you.
Thank you, Councillor Sahota. I don't think there's anybody else, but can I just pick up on Councillor Ridney's point about, you know, our communities, and she was quite right in what she said about, you know, the community. We know the communities, and it takes me back, if any members remember, that I did bring this up, I think it was last year at committee, about school readiness and the number of play groups and toddler groups that don't come under our remit as such, that are held in the local church hall, of how we can find out within our own communities how many of these are going on, and where we need to get, you know, perhaps approach them and say, would you like somebody from early years to come down and talk to you? And whereas these people are not particularly going to family centres. And as Sue quite rightly pointed out, and what Ian pointed out, is that it doesn't matter about your social or economic background. You can come from the most, you know, the richest, most affluent background, and still. And this is why a lot of them do go to the mum and toddlers groups. And do we need to be putting work into there rather than just concentrating on our children's centres, our family centres? So I'll leave it to you to answer everything, Scott.
Okay. Thanks, Chair. I've taken a note of the questions and who's asked them, so hopefully I'll be able to give a response to everything that's been asked. In terms of your questions, Chair, around family centres 2-year take-up and the data, in terms of the links with maternity services and where mothers to be and families, expectant families will be receiving services, I think it's fair to say that family centres have been underutilised in Dudley in terms of links with maternity services. So this has given us an opportunity to create better links, but that's not to remove some of the support that's already taking place within GP services and other community venues. So it's to complement what we've got already, not to take anything away. So that's so a mixed economy really of services where families will receive them and benefit from them most of all. The question around 2-year take-up and where there may be lower take-up in some of our areas where inequality is the greatest. They also happen to be some of our areas where English is spoken perhaps as an additional language, and there is areas where there is significantly more cultural diversity. So it's about making sure that some of our messages are made available to families in community languages, and that there are members of staff that are working within the council that also speak community language, to make sure that every child that would benefit from a 2-year place does take up that place, as well as the more general messages around the advantages that you can have around a child's development of taking up a 2-year place. Nationally, it's around 72%, and take up in Dudley is about 74% off the top of my head. I think that's the sort of figure. We're a couple of percentage points ahead, but that is of course prior to COVID. As I said, we don't know at this stage for this term's count what the take up is going to be like, as Councillor Ridney was saying. And then in terms of data, I think Councillor Sahota and yourself, Chair, asked the question around what the lead-in time is to understanding how long some of this information will take to come back to us. And I think it's very much dependent on that particular aspect of data. Infant mortality is reported on a 12-month basis. Take up of 2-year places is on a termly basis. So it very much depends on which aspects of the data that we're looking at, and of course the CCG and Public Health, the council take that information in on different frequencies, school readiness on a 12-monthly basis. So it very much depends on which aspects of improvement that we're looking at. Some of the impact will be more immediate. Some of it, as Councillor Sahota referred to, it's going to be a much more of a slow burner. Councillor Ridney raised some of the questions around community resilience, and it was really pleasing for us within Dudley and Councillor Ridney that of the 5 local authority areas that have been working as part of the Early Intervention Foundation work, we were the only local authority that had with us Vicky Burrows from the community voluntary sector, we were the only local authority area that had somebody from the CVS working with us right from the get-go. And I think some of the other local authorities looked on us quite enviously that we'd got that relationship with the CVS to help and build on our community resilience. But I think it's important to note as well that in terms of some of the information and advice that we might get from family members, it might not always be evidence-based when we're talking about important subjects such as when to begin solid feeding and also safe sleep as well. You know, there's lots of strong evidence base to make sure that children are as safe as possible, and that's where that balance of making sure that we take advice from professionals and also from our family members needs to be in equal measure and taken on board evidence-based work. You also, Councillor Ridney asked a question around vaping. This is one of the things we talked about throughout this programme as well, and you're absolutely right. I think it's very unclear at this early stage around the impact of vaping on unborn children, and that's something that I know there is research going on through the dialogue that we've had with maternity services. And also, again, Councillor Sahota mentioned around the trying to reconcile really the progressive universalism, making sure that we've got support where it's needed, but not removing universal services completely, and trying to get that balance right, making sure there is greater levels of support for families that need it the most, and that's something that we're trying to achieve through this programme. So I think, yeah, the last one was just around playgroups and support to our communities. All of the information is available through the Family Information Service, but we recognise that some of our informal playgroups and parent and carer-led and church-based, faith-based provision does need additional support, and that's exactly where the community voluntary sector can support us on this programme as well, ensuring that our settings get the right amounts of support to make sure that they're able to impact upon child development in the most sophisticated way, even though it's an informal parent and carer led provision.
Right. Thank you for that, Scott. So if I can move to the recommendations, that it's recommended that the members note the content of the report and that members suggest and support any areas they wish to scrutinise on the work being planned and implemented to improve maternity and early years outcomes through the critical first 1001 days vision. And I think that from the conversations that we've just had and the discussions, that perhaps we need to be looking at in a bit of depth, and this is where all members of the council, as corporate parents, which is for obviously looked after children, but also, you know, we're parents of all children, aren't we? So can we look at the community resilience and the small groups that we've just discussed? And also, I know Councillor Ridney has raised the issue of vaping, and you've said that there are studies going on at the moment, but obviously we need to wait for that. So I think that we could possibly in the future have an update on information regarding vaping, because it is an issue that you know, a big issue, smoking during pregnancy, but then they tell you that vaping is better than smoking, but we still don't know the effects that's got on the unborn child. So if members agree, I would recommend that we would wish to scrutinise in some depth the community resilience and how we reach hard to reach groups as well. And I'd welcome anybody's input on that. Do you want to speak, Helen? Helen?
Yeah, thank you, Chair. But I don't know whether you recall, and when we had a conversation, I think it was last week, we said this is quite a detailed area of activity, we talked about whether we wanted to run a bit of a working group regarding this particular subject, and call in our partners to have that detailed conversation. So I'm just kind of raising that here because I think that would be a really good idea.
Yeah, and also in the fact that if you read in the report that we, some of our, especially midwifery and health, people were unaware of what others were doing. I do think that we could possibly have our health partners midwifery, especially with regards to infant mortality. I do apologise, Helen. I've been to sleep since then. I completely went out my head. I think infant mortality is an issue as well that we could be looking at.
Yeah.
And get our partners. So if everyone agrees, I think Councillor Sahota, have you got your hand up again?
My apologies. Can you?
Oh, yes or no?
No, I think I'm endorsing with I think the two areas you're suggesting. That's
Right.
fine. Sorry.
Okay, Councillor Ridney.
Thanks, Anna. I would support what you're saying because, as I said, I think it's something we do need to look at, and taking on board the suggestions you made about our voluntary groups as well, and our mother and toddler groups. I think how many of those will still exist after this pandemic is over, I don't know, and it may mean that we need to look at some support for them, because I do think they play an important role, especially in our more deprived communities. Although I would say they're often a place just for young moms to get together and if you like, just share their worries. It's a shoulder to cry on, and I do think it's important that we should continue to support them. So I would very much take on board what you said, and so we have a working group to look at this.
Yeah. Okay. Thank you. All right then. So are all members in agreement then? I'll take it as a yes.
Yes. Yes.
Okay. Kim, did you get all that?
Yes, Chair.
Right. Okay. Thank you very much indeed.
Thanks, everyone.
Thank you.
Thank you.
Right. We'll move on to agenda item number 8, which is the elective home education. And we've got Jeremy Keeble to present the report. So hello, Jeremy.
Hello, everybody. Hope you can see me. Hope you can hear me. Everything should be working electronically. What I'm going to do, I'm just going to put my my version of the report up on the screen because I haven't got a hard copy. So if I'm not making appropriate eye contact, that's because I'm reading a document. So hope you can follow me. What I'm going to do is obviously refer to the report, but I thought it might be helpful, Chair, to update you, because if you look at the recommendations and the date the report was written, this gives you an update until July 2020. And the recommendation number 2 is talking about expected changes once we start to return to schools in September, so that it might be helpful, rather than dwell on too much of the historical stuff, to actually give you an update in terms of where we are in that position. So essentially, what I just want to make clear, and I'm sure a lot of people know this anyway, I might be stating the obvious, but we need to be very clear that when we're looking at elected home education, we're actually, as it says on the tin, and we need to be clear when we're processing applications that we are looking at them on the basis that as a local authority, we've got a statutory legal duty to ensure all children of school age have an education, and we can only really approve education at home if we're clear that the education is actually going to happen. So I'll talk a bit in a minute about the process, but it is all based on the parents have the ability, either themselves or by appointing tutors or whatever, to deliver the actual education. What is starting to come through, and Helen will know this, is we're on daily calls at the moment with the Department of Education, and one of the comments and the topics that's a regular feature is this is a national issue that the department are keeping an eye on, is the projected rise in applications for elective home education. And what we're starting to see is that those numbers are going up. So I can give you everybody some data that isn't on the report because this is the actual more recent data. So if we compare the last full month that we have with the same month last year. So last year, August 2019, we only had 7 inquiry stroke applications for elective home education. This August 2020, it had gone up to 17. Now, obviously, we could debate whether that is statistically significant, but there's relatively small numbers, but they have more than doubled. So you could look at it in terms of a 200% increase. I was actually in a meeting with the team concerned, the Pupil Access team, who basically being split as we move forward, but I'll talk about that in the second paper. I was actually talking to them yesterday, and in the 3 days to yesterday, they'd had 28 applications or inquiries in 3 days. And while I was actually in the meeting, which was about 45 minutes, another 3 dropped into the inbox. So if you just do some very brief maths, around about 30 in 3 days, 10 a day, we could be looking at a couple of hundred across September. So there's very clearly a spike. We know from other local authorities that Sandwell are going through a similar rise. The reason I think it's gone up much from August to September is clearly that in August children were at home. And what's starting to happen, and we've had these discussions, Helen and myself, with the department on the calls, is that what's starting to happen is that parents, and we're all on a scale somewhere, aren't we, of some level of anxiety. It'd be unhuman if we weren't all feeling some level of anxiety in a pandemic. But there are some parents who are clearly very, very anxious to return their children to school, genuinely very, very worried. There may be parents at home who are themselves, grandparents are shielding. And the concern from the department, which obviously we support and we're working with them on, is that this rise in EHE applications and potential, requests to actually educate children at home is not driven from a real genuine desire to educate children home, but rather as a kind of get out of jail card because they don't want their children to be in school. So we're obviously going to have to be much more systematic in terms of how we deal with those, the large numbers. We've got to look at capacity in the team. But we've obviously, one of the things I said to the team yesterday is we need to be very clear that we look at them on a very, very detailed case by case basis, because within that, there will probably still be a few who genuinely want to elect for home education. But obviously the larger majority, and this is, as I said, a national pattern coming through that we're aware of in our conversations with the likes of Sandwell, other Black Country authorities and the department, the national pattern coming through is there is an increase that's increasingly driven by parents not wanting their children to be in school. So it will be a case of looking at it on a family by family basis. If I just return to the paper just briefly, looking through, I've given you the background, which I'll take it as read. It talks in points 7 about the sort of capacity that we have, and obviously if we do get this huge spike coming through in terms of interest and applications, I'm just giving you the inquiry applications. They won't all be processed to be given EHE status, but we will need to look at the capacity of the team to process those properly. This also does link into the capacity to look at statutory responses where children aren't coming to school as well. We're being quite sensitive in terms of being supportive of anxiety to a point, and this comes back to the point of considering them on individual merit when we get applications and when we have non-attendance. We are now on the 6th full day back in school. So if a school was not only having one inset day last week, so Wednesday, Thursday, Friday last week, Monday, Tuesday, Wednesday this week, we hit the 12 sessions limit. And so technically, if a child hasn't returned to school for all of those 12 sessions, then we could start looking at moving down to fixed penalties. And this is what I think some of the anxiety would be driven by. Parents who are also worried about their children coming back to school are not going to re-engage if we start going down too fast into a statutory route. So I've spoken to Helen, I've spoken to the lead member, and we're of the view that obviously we're not going to fail to support our schools. I've been a head myself, and if heads want to make referrals, we will support them. But we're going to balance that with trying to give the right families who we feel are genuinely anxious the support to come back to school. Just linked to this, we're part of a national strategy called Wellbeing for Education Return, which our Principal EP Dawn Goodall is leading. So we're going to work to support families back in, but obviously where families do refuse to engage, we will have to look at going down a statutory route, as well as considering in great detail whether we grant them the application for elective home education. So what I'm trying to say to you is it's more than elective home education. It's unpicking all of the reasons why parents are opting to go down that route in the first place. Andrea's on the call, and when I go through some of this, if you look down a little bit further, we've got some safeguarding issues here. This is down in paragraphs 23 and onwards, and I think Andrea, if I remember, Andrea, I won't take credit for this, I'm sure you gave me some of these paragraphs to put in. But one of our obvious other concerns is when children aren't in school, that there's no actual link between elective home education and increased safeguarding risk. But what we do need to be bear in mind is we don't see those children every day when they're not in school. And I think one of the successes that we had as a local authority was when we were prior to the summer and we had children at home. If you remember, prior to the summer, it was certain cohorts, reception 1 and 6 in primary and 12 and 10 in secondary, and then our key groups of key workers and our vulnerable children. We had large numbers of children not in school. Obviously the vulnerable ones were, but we were very good at making those welfare calls. But that's because when children aren't in school, we haven't got that daily oversight of them. They're not coming into school and meeting their form tutors every day. They're not going to PE. They're not going to all their lessons. And all staff now under Keeping Children Safe in Education are trained to spot all these signs of neglect, abuse, children who come in obviously haven't had their hair washed for 2 days, and all these early warning signs. The obvious issue that we face if we've got a spike of education at home children is that we've got a large number of children who we don't have that daily contact. So I need to be clear, there's not a direct link because children are at home, but we just haven't got that oversight of them. And particularly for some of our more vulnerable groups, I'm talking around our children who've got children in need or child in need or child protection plans. It's really important that the services around the family are very aware and very much in touch. So there's that element of it. Health support is also part, and we're on paragraph 32 if anybody's following the actual detail. I've already talked that, looking at well-being for education return is vital. There will be, even for the children that are in school, but particularly the children that are out of school, they will be in part anxious alongside their parents. I think if you're in a family where there's high levels of anxiety, particularly for our very younger children, they are going to feed off that. So it's important to make sure that we're aware of any issues, and public health will support as well as that. There's a section here in terms of year 11s and making sure that they have a school place. And we've been working very closely with Connections to make sure that some of those children actually have a route when they go on to college. That's something I'll touch on, Chair, in the next paper, where we've done a lot of work over the summer with our year 11s who, when we went into lockdown, were partly through their decisions and destinations making process. So we've done a lot of work to ensure those have a college place, and we've been very successful. So that's a kind of link between the two papers. The sections at the bottom from 37 onwards, essentially, as I said, this is just the historic data, which I'll just leave with you. I won't dwell on it because what's going to happen now is this data will change so much. What it shows very broadly, if you look at the graph on section 41, is that we, as the numbers for Dudley are in blue and the national figures are in grey, historically we've ridden slightly below the national for EHE over a considerable period of years. That graph goes over 14 years. And we're mirroring that now. So as I said, our spike in numbers has increased very much in line with other local authorities, and we know from speaking to the department that we're not anywhere we're very much in line with the national figures as well. And again, the table in box 42, I won't dwell on that because again we could get into some knots here about looking at how year 1 comparing 2017 to 2019 against year 8 in 2017. That data has changed so much in the last month. With all respect, I think we're probably better to look at the data where we are. So coming on to the finance, I mean, we are, and I'll talk about this again in the next paper, or in great detail. We are obviously looking at we are reviewing the education outcomes teams generally, and as part of that we are looking at how what was the pupil access team is now operating as 2 separate teams, and I'll come on to that in the other paper. But obviously, as I said, to reassure you that with this extra spike of applications we're anticipating coming through, we have got the capacity if necessary to make sure they're all processed, because the key thing is these are all, every one of those 200 applications, an individual family, an individual child, families who are very, very anxious, and they deserve our full support to make sure that the individual decisions we make in relation to parents and whether they are granted the ability to have education at home or not. Because obviously, as I said right at the start, it's not about opting out of education, it's making sure the child has an education, and we either support the family to have that at home or we make sure that they are supported to return to school. So there's a section at the end referring, Chair, to and everybody else to the legal aspects and the various acts that we have to work to. And as I've said, I've mentioned this already, but 53 is the equality impact. All statutory age school children have a right to education, irrespective of background or academic ability. So that I've covered off already. So I'll politely leave it at that, Chair. And if there's any questions, I'm happy to take those.
Right, thank you very much, Jeremy. I'm calling on Councillor Serena Craigie.
Thank you, Chair. Thank you for the report. On page 28, as you said, there's evidence of schools encouraging parents to home educate. It's a great worry to me, home education, because of the lack of curriculum and the standards, etc. So with that report, when is it going to be ready and when we're going to be able to review it? I'm also worried about it could be a way for schools to manipulate or manoeuvre pupils that are underperforming to make the stats look better. So also engaging in that. So could you give us an update on that, please?
Can I think Councillor Sahota's got his hand up. Councillor Sahota. Harmjit? Oh, sorry, wrong one. I do apologise. Oh no, you're here. Go ahead.
I think just quickly, I think it's very detailed report. I think this just adding to what Serena's just said of that paragraph 13. I just need some reassurance that the Dudley are using its powers to make sure kids not being sort of offloaded. Where are we being robust with where we're seeing that's happening, and what are we doing to challenge that to support pupils?
Okay.
Councillor Ridney.
Thank you. Thank you for the report, Jeremy. I have a couple of concerns. One, along with my colleagues, about the paragraphs about the evidence of schools encouraging parents to home educate. That I find quite disturbing, and we have had hints of this over the last couple of years, and I agree with my colleagues. We do need to know and be reassured that this is being challenged. The other issue I have is about when parents first inquire about educating at home. What information are the parents given, and what data are they? What information are they given? What instructions are they given? Because having had casework where people seem to have been made assumptions about things that were going to happen that did not happen, because my understanding is that once they decide to home educate, it is for them to decide the type of education that their child has. They're under no obligation to follow the national curriculum, is my understanding, and it talks in this report about the judgment of what education they are having. It doesn't necessarily have to be the national curriculum, but obviously someone has to decide whether it is a good education or not. And one of the concerns that I've expressed at this committee before is about the safeguarding aspects. The Education Act, when it was first decided, was not just about educating children. It was laid down in the way that children should come to school, so there was contact. And I think that's quite an important aspect of this that we need to know, so that someone else is seeing that child. Well, I read in the report that we have no major safeguarding concerns. That's fine, but I do think that children mix with other children, that children have playtime, that they have PE lessons, that they do art, and with other children. It's about socialising, that they eat a meal at a table with their friends, that they learn the social graces, etc. So I think there are other aspects. And may I suggest, Chair, I feel that this would warrant a working group just to look at this in depth, really, because I think there are lots of questions. And may I also make a suggestion? I have spoken with the person who is actually in charge of home education, and I think if numbers are rising in the way, that poor lady needs some support. You can't leave her on her own.
No.
The next thing, she'll go off sick long term.
Yeah.
If the numbers are rising like that, let's just have a look at giving her some support, shall we?
Yeah.
You know,
Yeah.
I know we've got thousands in the coffers.
No.
but there you
Well, I might quote you on that, but
no,
no.
don't. But let's give us, if numbers are rising in that sort of way, we doing it. And I know she does. Having dealt with her over this year with some casework, I know she works very hard and tries to do what she can to help these families.
Okay.
I'll shut up now.
Right, thank you very much. So, yeah, there's a number of points that I want to bring up as well, Jeremy. You said at the beginning that the local authority can actually refuse. Is that correct? If we don't feel, if you answer them all at the end, it'd be better. That we can actually refuse if we don't feel that they are going to actually be educated at home as they should be. So that was my one point. Secondly, a few of my colleagues have already brought up about the evidence of schools encouraging parents to home educate. Other members may have heard rumours. It actually happened to me, to a family in my ward who was told by a school where they wanted to change to a school where they'd moved to, and the previous school told them to home educate and take the children out. That was being investigated by our then acting head of service, and I don't think I've had a response on that yet. So I know that it happens because it actually happened to a family in my ward. The other thing is that I know that we're awaiting an official response from government, but I was absolutely horrified to read, because I didn't know much about this particular subject, so I started to look into it, that it's an area largely unregulated by central government, and that just fills me with absolute terror. I personally, and it is a personal view, I don't agree with elective home education. I really don't. I really don't. I fully endorse what Councillor Ridney says about a working group, but I feel that under the recommendations of the report, that myself as chair, scrutiny chair, and possibly with the agreement as well of the cabinet member and this committee, that we send a strongly worded letter to raise our concerns to Gavin Williamson. And I would like to know if members would be in agreement with that, but I'll ask that question again at the when I go through recommendations. Excellent. So those are a few things that I want to throw in the mix at the moment.
Okay.
Thank you.
Okay, well, I think for the three of you who all asked the same question at the start about schools encouraging, I mean, I'll cover some of that in the second report, but when you look at, I'm sure you've already read the paper around the sort of principles that we're working on moving forward as a local authority, it is providing much more challenge to schools. And one of those principles is around minimising exclusions, minimising movement around the system. So we are going to put in place a lot more challenge. I mean, certainly if I were to pick up on any kind of communication where schools were encouraging children to stay at home or to find another school or to do whatever inappropriately, I mean, it's covered off. One of the points I made in the presentation to secondary heads on Monday morning when we launched the strategy, and I went through the Ofsted framework and said this is not a moral option. This is something that you do need to do because this is what you're expected to do under the Ofsted framework. And it talks about no off-rolling or gaming, which is what this comes under. It's one of the leadership and management judgments for the Ofsted inspection. So Helen and myself are very committed to taking schools on and challenging them if they don't operate according to a generally inclusive philosophy and our principles. So I'll go through those and I'll pick those up. In terms of how we can work when parents come forward, I mean, the law, as it says in the report, is not absolutely clear. What we would look to do is discourage parents who we don't feel have the means, but it gets very grey because it's not, and that's where the clarity and the investigations and the consultations and the government have to come to an actual decision, because ultimately if we were just to outright say no, some of those parents would just refuse to tell the children in. So it has to be, you know, raising our concerns, making them aware of the duty to actually provide an education. It's not an opt-out, it's a statutory duty. In terms of the safeguarding, and I made the point when I mentioned the paper, you know, you're absolutely right, Councillor Ridney, I think, who said it, that it's not seeing the child in school that's the issue and all of that regular contact. It might just be a child's demeanour, as I said, they look a little bit unkempt, their uniform hasn't been washed. If they're at home, all of that is hidden, and it makes it more difficult to pick up. As I said, there's no evidence that there is any more likely to be a safeguarding issue if the child is at home, but it's just that if there were, we don't pick it up and we don't see it. So be reassured, Chair, and everybody else, that we are looking to be very, very robust with our schools, and we will challenge this. The issue around particular, and I would support that letter if someone wanted to send it to Gavin Williamson. I'd be happy to sign it. I think there does need to be a lot of tightening, because this is going to become a big concern if these spikes continue, and we're getting these numbers of parents who are effectively saying we don't wish our children to return to school. I think we need to be a lot more robust around it from a national perspective, not just a Dudley perspective. I hope that answers everything.
Yeah, there is one more thing that I'd written down, and I'd mislaid my bit of paper. Do we have a breakdown of ethnicity for these children? I think that where I'm trying to come from is that certain cultures, don't put a high emphasis on the education of females, for example. Would then do sort of have we got any instances where communities sort of educate children in perhaps a group of 2 or 3 away, call it home education, but in fact it's not really home education, but it's not within an educational setting? That, I think that's where I'm coming from.
I don't have that data to hand, but I'm sure we could look at it, and certainly we could capture it going forward. I mean, the question I thought you were going to ask there was about BAME communities not wishing their children to return because they're more at risk, but it's the same kind of question in a different way, isn't it? We don't have that data, but I'm sure we could capture it. We wouldn't have it on that spike at the moment, because this would literally be emails dropping in and phone messages and so on, but we could capture that if you felt that was useful.
Yeah, Councillor, Councillor Ridney's raised her hand again. Sue?
Thanks, Chair. I was just concerned in the quotes in the paper about the increase in numbers in primary. I think that is a matter for major concern for us, Jeremy, because for the very young, while I can understand those that are older, secondary level, I can understand that they may wish to not be educated in school. For the younger ones, I think it's quite important that we look at this very, very strongly, and look at suitability. Well, not suitability, capability really of parents to support those children in an educational setting or in their own homes. But I am really concerned about the quotes in here about the rising numbers of primary children.
Yeah, no, I agree. That's a major concern, because obviously the gap's only going to grow, isn't it? They're not going to get to a threshold of literacy and numeracy before they disengage from the school system. Whereas a 15-year-old, I'm not saying it's correct, but a 15-year-old who doesn't do the last year, at least they've got the guts of a full education. I fully support.
It's the repercussions in later life that we need to consider.
Right, if there's no more questions, then I'll move on to the recommendations.
Chair?
Yes, sorry.
Sorry to interrupt, it's Helen again.
Hello.
I've got Councillor Christine Perks has got her hand raised.
All right, I didn't know she was here. Hello, Christine.
Hello, Anne. Apologies for late getting in. I couldn't get in on the screen. I was here. I think the question that you were asking, Anne, were the questions that I was going to ask about the variations in the ethnic minority amount of children coming out of school or going in, because this has been a question that's been going on for some time. Because previously it was a case where when children were taken out of school for home education, there was very little follow-up after they'd gone out of education, and it was quite a worry on the safeguarding of children, obviously, especially girls. I know this is a sensitive area, and people don't like to actually ask that question. It's a question that we actually need to know, and I think where Anne is getting to as well. And that's the question that I was going to ask. Is it any more now than it was before? And are we keeping a track on people, ethnic minority or not, as to whether they are having an education?
Yeah, I've just made a note. Councillor, just to say that we will try and capture that data going forward. So I've made a note and I'll make sure we get that breakdown collected for you.
Thank you.
Right, thank you. I think Helen wants to come in. Helen?
Yeah, I just really want to just go on the back of what Jeremy's just presented tonight, just to say that we have daily, they're called react calls with DFE. So that these happened as soon as we went into lockdown from March, and then they've continued as soon as the schools have opened. So we had daily calls last week, and we'll have daily calls this week. And every call we talk about elective home education, we're reporting back the increase, and we've started to have the comparisons with the other authorities as well. So what we're challenging the DFE as well as a local authority to say, well, what are you doing in order to support the LA in regards to the spike? So just going back on what you said, Anne, about that letter, I think that letter would be a good idea.
Yeah.
But within that, I think for me, it's just to ensure that Scrutiny is aware of the calls that we're having with DFE, and we're ensuring that rigour and challenge back to DFE as well.
Right. Thank you for that, Helen. Well, I think that we've captured everything there. So the recommendations are, I'm not going to read it out verbatim. Everybody's read that. But I'd like to add on to that, Kim, for Democratic Services, that we do send a letter to Gavin Williamson, highlighting our grave concerns, our concerns that the numbers are increasing, and of how little sort of jurisdiction we have over this. And, I know, as I've said earlier, that we're awaiting an official government response to a report, but I really feel that ourselves, we should be writing to him. Also, I think we should be writing to the LGA and getting support from other local authorities. And I'm not, and I've said this many a time, I will not allow children's services to become a political football. But this is a case where we are concerned about our children, whoever's in control. So I do think that following this meeting, I will make contact with officers to get that letter. If all members are in agreement and are in agreement with the recommendations, is everybody in agreement?
Yes.
Right. Okay. Thank you very much. So we move on to agenda item number 8, which Jeremy again is going to present.
Okay.
Sorry, it's 9. Sorry, oh no, it isn't. It is 8, isn't it? Oh, I've got it wrong. It's all right. It's me. What's it? Summer provision and September school update. So Jeremy, over to you.
Okay. Thank you very much. Okay, here we go again. This one I hope is a little bit more straightforward, certainly for the early part. I'm going to start by giving you an update on the summer provision and then talk to you about the September position, although as before I can give you some information in September that isn't actually contained in this. We set out, if we go down to number 3, we set out to coordinate as much provision across the summer as we possibly could, conscious obviously that a lot of our youngsters hadn't been in school since the end of March. I think it was March the 23rd, wasn't it? We officially went into lockdown. And so we looked to run a wide range of programs. So going through from point 3, it just summarises what was going on. So a number of our primaries set up provision across the summer. Jesson's put on a particular program in response to the COVID situation and their more vulnerable youngsters. The others had a mixture of targeting vulnerables. Milking Bank did the same. Some of the others were just running sports clubs that they would historically have run each year and using some outside providers to support that. I also mentioned in the previous report that we did a lot of support for our sort of year 11 and college based children. This was, as again I've already said, we were aware that some of the year 11s were kind of left a little bit in limbo, because in March is the kind of time where you've maybe made some applications to 2 or 3 colleges, but you haven't actually confirmed a destination. And we also had some year 12s who were wavering on courses, and year 13s who would normally go on to higher ed but didn't want to pay the fees, the sort of stuff you can read in the press of students paying exorbitant fees to sit in their own bedrooms and receive their training online. We also looked at people who may become unemployed because of the furloughing scheme and so on. So there was a large bit of provision that was put in by John Cunningham and his team. He's not here, but I'll place on the record thanks to John, because that was largely his piece of work. We worked with Mark Grundy at Shirelands Multi-Academy Trust. Mark made available a programme called Edu School across the borough to all of our schools. I think the figure that he quoted me when I spoke to him last week is just over 1,000 year 10s took advantage of that. Dudley Matt particularly bought into it whole stock across all their academies. Some of our schools did as well, the non-maintained non-academy schools, the Briar used it and so on. So that was really successful. It started 2 weeks before the summer and supported youngsters right through. Dudley Virtual School put on a range of provision. Also, we put on, I suppose this was our kind of flagship really. We spent a long time planning this because we wanted to do something that kind of held everything together. So Chris Jones at Dudley Performing Arts did an amazing job energising his team. And you can see the timetable there. The full details aren't that important, but just to let you know the kind of things we were doing. We worked at Resonance for the first week. The intention was to do a more wide-ranging second week across cultural venues. We were initially looking at the zoo and the castle, but for various reasons, largely around social distancing, they didn't feel as confident. But Black Country Museum were amazing and really supported us. I mean, I won't play it to you, but somewhere in here you hopefully have got a link to the video. I was very clear at the start of this with Chris that we wanted to capture it as a video, as a real celebration of what people had done. And it's really quite moving, really, the video that shows all the children playing the music, and at the end they're on the swings and you can hear the happy voices. So all of those programs ran. Looking in detail, I mean, I won't read it to you, but the year 11 engagement, I think we've already talked about. It was about supporting children who were left a little bit high and dry when they were halfway through applying for college. We're particularly supportive of our SEND children. A lot of case officers and social workers work with those very vulnerable children to support them into their post 16 and 19 programs. Lots of advice, lots of support. Connections did an amazing job. We worked with the Careers Enterprise Council. Lots of other agencies chipped in and gave us support with our NEET children, or the children we did not want to become NEET. No, we didn't want children not to be in education, employment or training. Some of the colleges were really supportive, Dudley College as well. I mean, one of the things you'll find in this report is that there are some buried links. So if you can click on some of those links and it will give you the detail of what Dudley College did. Black Country Impact were also very supportive and worked with us. You can see underneath all of the different providers that worked in terms of engaging with us and them on apprenticeships, so rail track, gas engineer, and there's a really good range, and you can see the number of opportunities that we're able to offer. I mean, it's in the hundreds. I suppose I should have done the maths and added it up, but it's well into the 200-300s there in terms of opportunities and the qualifications those young people could get. Year 11 leavers and SEND, and work experience was also another part of it. I mean, there were several. But particularly we wanted to thank Broxwood Animal Sanctuary for offering work placements to some of our youngsters. So the intention was to offer as wide a range of opportunities, as I said, in the middle of a pandemic when children and young people were finding it difficult to get their roots into post 16 and post 19 confirmed. We felt it was really, really important. So just to place on record, thanks to all those providers, because we wouldn't have been able to do it without them. Andy Wright, as part of the virtual school, laid on a number of events. At the time when I wrote this, I haven't got all the numbers for all the different sessions, but they were well attended. I've got that, and I could get that to you if you wanted that. Obviously, the turnaround report, this report was written sometime in early August, so I didn't have that data to hand. But the other thing to say with this, Chair, is that we've got the exam results for the virtual school children, and they are very, very strong this year. Obviously, some of that data is unverified with all of the issues we've had in terms of capturing it. I can talk about that at the end if anybody wants to talk about exam data. But the virtual school put on an amazing summer program. In terms of the DPA events, I won't lie to you, I was a little bit disappointed by the overall attendance, but I think what we've got to look at is we deliberately targeted children who we felt would have issues re-engaging. If we'd have targeted a very different cohort, of a cohort from a different, township or a different client group, we would have probably got 100% attendance, but those would have been the children who probably would have come back to school and have come back to school without any issues. This was very deliberately an attempt to target the children who would have an issue coming into school. And so in a sense, as hard as everybody worked, we didn't get above 60% attendance. But that's not to say that the children, and again, going back to the video, the children, young people who engaged in it had a fantastic time. And without reading it to you, you've got some lovely quotes there. Number 36, a little girl who said she'd been in lockdown colouring, and this was the first time she'd actually done something new in all of that time. One of the other things that came through was, children coming in, and I think it says it in the footnotes on the video again, children came in at the start of the day, their parents were quite anxious, and yet by the end of the day, they had a fantastic time. And the number who said they wanted to be musicians, I think that was possibly said on the day. I'm not sure they've now got it as a real career choice, but it kind of says how much they bought into it and how much they enjoyed the day. In terms of, so that kind of concludes that bit. Moving on to the second section then, and this is the bit where we're talking about what's happening in September. And I would like to think that some of what we did in the summer has supported what we've achieved in terms of September. Helen said at the start that we're round about the 90% target in terms of 90% rate in terms of our actual attendance, which I think is very good in terms of what we could have expected. And obviously there's a lot to do. We've got 10% of children who are not regularly in school, and we've supported schools in terms of getting those children in. But to start at 90%, I think we all went. I've just written the intro for our bulletin I did it before the meeting. I wasn't doing it while I was trying to do this, but earlier this afternoon I've written the bulletin, and I've said, none of us really, if we're honest, really knew what we were going into post lockdown and opening the schools up. And a lot of the comments from heads, Helen and myself, as well as talking to the DfE every day, we talk regularly to our heads. And heads were saying on the call last week that it's lovely to hear the sounds of children back in schools, to hear the sounds of teaching and learning. I think some of what we did in the summer has really, really borne fruit in terms of getting those children back. In terms of, and this picks up from some questions some of you made at the end of the last presentation, what we are really looking to do now is up our game as a local authority. And what we're launching with, I launched it with the secondary heads Monday morning. I'm doing it with special heads tomorrow morning. We're also launching it with governors in the next week or so, and with our primary colleagues, is having much more of a clear focus about what our education strategy is. And I'll be very careful how I say this, that it's not any critique on anybody who's gone before. We've got some amazing work going on in Dudley, and I said this to the team in education when I launched it with them last week. But what we don't seem to have is sort of an overarching strategy, to the point where if you say to someone in Dudley, what are we actually trying to do? What is our vision? I don't think you'd actually get one. So we're trying to launch it around 6 key principles. The theme through it all, and this again picks up on the questions that you asked last time, it is all around inclusion. And the reason, before I just quickly go through them, is that they've got 6 principles. We're very aware that our secondary sector in particular is very highly academised. We've got 15 of our 19 schools in academies. We've got 5 different groups. If I was to start writing a curriculum vision, they would all very politely say, no, thank you, we've got one of our own. But if we launch it around key principles, there's nothing here that we would expect someone to say, actually, we can't buy into that. And in the presentation to heads, I finish at the end, I won't do it with you, but I finish by linking this all to the Ofsted framework, which talks about inclusion. So these are the givens really that I'm rolling out with our heads this year, that we all take collective responsibility, regardless of whether we're in MATs. They're all Dudley children and young people, and we treat them the same, and they ensure their needs are met. Inclusion, and this comes back to the point I've already made, I think there's also a piece of work, and again, some of this is already being done. It just needs to be put together, but we need to make sure our systems are much more inclusive and joined up as well, and coherent. One of the issues we've got with our mainstream schools not being as inclusive as they should do is that we tend to find a lot of children end up in our special schools who possibly shouldn't be there. Some of our special schools are designated MLD, moderate learning difficulties. Well, I've been ahead in a special school as well as a mainstream school. And if you've got the right provision around those children, MLD children should be in mainstream. And the knock on for that is a financial one, which I'm sure some of you are aware of in terms of the educational budget. If we fill our special schools with children who shouldn't really be there, then we haven't got places for all of our special needs children, and then we spend a huge amount of money on out of borough placements, and that's a huge overspend to the local authorities. So there's a financial reason as well as an inclusive reason to have our system joined up. We also need to get all our different colleague heads and their schools working much more coherently. We've got a lot of expertise in our special schools. All of our special schools are rated outstanding or good by Ofsted, but I'm not sure how much of their practice is shared with the mainstream, and that's just one thing. The fourth bullet then links back to what I was saying earlier. We're committed to reducing exclusions and the movement of children. I suppose that would include EHE, although it's not implicitly stated. The piece of work on coordinating our teams I'll come on to in a moment, and the communication, we're working to be much more transparent. So for example, without getting into the details, we've got a piece of place planning that we need to work through. We need some extra capacity in Hale Zoe, and we need to temporarily reduce the primary pan coming through because we've got a dip in birth rates. We're sharing that data with the heads at a very early stage. They're saying they've never seen reception numbers and birth rates in that sense before, so they're really buying into it when we engage with them in terms of the data. So in terms of organising the team, if you're following it, there is you may have printed it off black and white, but if you've got it in colour, just above number 48, so within 47, this is how we're putting in place a new structure in terms of the education team. We're calling it a communication structure rather than a line management structure at this stage, because obviously there's a piece of work behind this where we will need to create posts and possibly make posts redundant. And there's lots of consultations and individual HR timelines and decisions to be made through. But essentially the central focus on this is around the teams that are in blue. If you look at the bottom in the middle box, which says school improvement, we've only got actually 2 people in that team at the moment. There's a primary advisor and a secondary, and I would probably include myself as the third one, although I've got a few other things to do. So we need to get all of that team widened, and what we're doing is bringing together all the other teams under a wider school improvement banner, so that we've got more people that we can deploy into schools. So that wider improvement box just under the orange box that says evidence-driven deployment and proactive support and challenge, we need to actually get our teams where they need to go. I think historically some of the teams in the bottom have pretty much, particularly our traded services, and that's a separate argument really, but they've pretty much gone where they want to. And one of the things that I've made clear in the last few weeks is they actually need to go where they're needed. It's a bit of a sea change. It's a cultural change. They're not used to being directed in this way, and we're getting a little bit of kickback, which you expect when you change systems. But it's really important for Dudley and the children that the support goes where it's needed and the challenge goes where it's needed. The one that I referred to in the last paper, if you look to the left-hand side, if you're following this, there used to be a team called the PAT team, the Pupil Access Team, and what I've done, obviously working with other people and with Helen's full consent, is that we've divided that into 2 separate teams. So there's what's called the Education Investigation Service, which is more of your statutory service, and then the inclusion team beneath, which is going to be part of a team that's going into school. So the plan is to appoint another school improvement officer to lead that team, and then working across the bottom, all of those teams work together. I'll come back to them in a second. The other team at the top, the admissions team and the Dudley Performing Arts teams, the green teams pretty much work more autonomously. So admissions does what it says on the tin. They manage admissions and all the issues around it. Dudley Performing Arts did an amazing job in the summer, but they go in almost as sort of peripatetic support. Whereas the plan is across the bottom, all of the other teams, early years, school improvement, learning support, specialist school improvements, inclusion services, that includes all of our hearing impaired, visual impaired, physical impairment teams and so on. We want to coordinate that provision so it's going where it's needed. And as part of this, we've brought SEND into the education structure so that we know what our SEND team is doing, because it wouldn't make sense if our SEND team were doing something completely different to our inclusion team. So the strategic lead for SEND, Tony, and her assistant, Sue, join us on our regular meetings. It doesn't mean they're part of our overall structure, but they join us in order to have that overall communication. So that's how we're going forward. Other things just to bring to your attention, Chair, in terms of what we've done, as Helen said, we've had regular meetings, those township meetings. I'm on number 48 now. we've reduced those down to weekly, largely because if you're ahead in a school now and you've got all the children back in, you really can't afford to meet with the local authority twice a week. But the weekly meetings, and we triangulate questions from them to the department and go back again. It's really very good in terms of just supporting our schools. You know, sometimes head can be quite a lonely job. I've done it, and you just want to feel part of a team and feel there's someone who's got your back. And I think, you know, the way that support has been put in place and the kind of increased engagement and partnership with the local authority in lockdown will serve as well, particularly in terms of some of the things like the pastoral relationships I mentioned earlier, some of the calls home, the well-being calls, checking children are all right. That's been a lot more robust because we've got more practiced at it during lockdown. In terms of September, I mean, there are just various things. We put together an overall action plan, a risk assessment plan for all of our teams going in. We didn't want schools and teams having to fill in myriads of paperwork. Again, they've got better things to do. We put in a commentary on the guidance. We give them regular updates. I mean, I put together a bulletin that goes out every Friday. And if there are any updates and guidance from the local authority, or we had something this week from the Health and Safety Executive that they may be going into workplaces, including schools. So that goes in. I'm just finishing something around open evenings and we're revising schools. It's probably not a good idea to have lots of parents walking around your school at the moment. So we need to obviously put some guidance in and some kind of leadership from the local authority in terms of what we expect. The letter on Appendix 4 is just something that we put together, Helen and myself, before the summer. Heads were saying that they felt they wanted a steer again from the local authority. And I think it says a lot about the increasingly positive relationships with schools that they're actually asking us to provide a steer for them. I'm not sure not so long ago they'd have actually wanted that. But we supported them with a consistent view on children need to be back in school, and we won't be setting work at home when children don't come in because that will discourage attendance. Things like, you know, you need to be aware that your school, in terms of parents, you know, you maybe have to drop off in a different place, you may have to park in a certain place. Linked to that, just as another offshoot, we are currently, Helen and myself, working with the police. We only mentioned it, I think, the last day or so. There's a park safe initiative that's going through, which we're going to get 2 heads from the primary phase and 2 heads from the secondary phase to work with the police themselves to improve parking safety around schools. So there's a lot of support and guidance there. And as I said, I think that's largely led to a very successful return to school, and the figures for attendance are high. They're very positive comparably with other local authorities as well. So we're well in the picture in terms of the national. Where when I've shown my screen, I've suddenly gone dark here. I think the sun's gone down, so you probably can't see me, but I am still here. So it's all very positive in terms of the return to school, and we're very, very pleased and proud of what our schools have done.
Councillor Perks, I believe you've got a question.
Yes, thank you, Anne. My thing is about special schools. As you know, it's my forte. And I agree with Jeremy. There is some children that may be in special schools that shouldn't be there because that is a fact of life, that some parents want to keep their children in that group. But I also know, and I know I keep harping on about this, but it only seems to be me, there is not enough spaces in special schools. In Old Park, we've got 14 children on a tracheotomy. I spelled that, said that right. And it makes it difficult for these schools. I would like councillors from this committee to go to Old Park, to have an invite, to go around and see what they actually do, because it's all right going on about main schools, which is very, very important, but we have not got enough places. And this is why we are trying to move children on the borderlines into mainstream schools, which then they have to have personal assistance, so we're not going any farther. And I've really got a passion about special schools, as I've worked with children with special needs since 1980, and had children at my own home with my husband. So I do know the problems that they are faced with, and it's not something we can push under the carpet because we just have not got enough spaces in these schools. and we're not doing anything about it.
Mm-hmm. Do you want me to respond to that now, Chair, or we're taking them at the end?
Yeah, wait. Has anybody else got any questions? I'm not seeing anybody's hands up. Ellen, if you can. Oh yeah, Councillor Aston. Yeah.
That's it. Yeah.
Thank you. Just to carry on from what Councillor Perks has said, there are pupils at Old Park Special School not able to access school because they have a traction in the neck, which is deemed as high risk due to the COVID. I wonder what plan is in place for these children.
Mm-hmm.
Right, Councillor Ian Bevan, please.
First of all, Jeremy, thanks for this report and for talking us through it this evening. You did mention this, but I didn't quite catch all of it. Are students that are educated at home able to access this provision?
Which provision are you talking about?
The summer provision and the programmes that we had running throughout the summer.
Yeah.
Right, I don't think there's anybody else with their hands up, so if I can just ask my questions and point a couple of things out. Yeah, if I can just respond, and I know that Jeremy will do this as well, and perhaps Helen will come in, but I am aware of the children with the tracheostomies.
Mm.
It's Public Health England that we are following the guidelines from. It's not a local authority issue. We're banging our heads against a brick wall because Public Health England are directing this, but Helen will probably tell you that we're hoping by the end of September to get those children into school. I know one of our neighbours, for example, I think it's Walsall, they're having them in and they're teaching them in isolation. Now, that to me is not the right thing to do. The other thing I just wanted to bring up, and I'm really, I think it's absolutely fantastic work that's been done across the borough, during the summer months. And I'm really pleased to see Broxwood, the Animal Sanctuary are going to be involved because that's just on the border of my ward. But there is another organisation that does take young people from the college. And I don't know whether you're aware of this. It's the Greyhound Trust in Sedgley. And that's a really, really, because of retired greyhounds are such docile dogs, and they've done a lot of work at the Greyhound Trust with young people, especially young people with, who are SEND. So that's just something, in the pot.
Okay.
There is something else I've written down, and I can't find it. Oh yes, yeah. What it was. And this is probably I hope you don't think this is a daft question, and it is probably impossible to answer, but moving forward, and we keep being told that there could be a second spike, and we're having changes every day, but children can go to school. Are there any contingency plans in place for schools that cannot, run properly because of staff being ill? Would children, would we call upon supply teachers, that sort of thing? So really that's all I want to ask.
Okay. Right, if I go through them, and I'm aware 2 or 3 of you have asked the same thing about Old Park. We've been working really hard on this, and as Chair has already said, we are constrained by some of the guidance, but we've got basically working on 2 prongs at the moment, and we're hoping to get those children back in very, very soon. And I did write to all the parents yesterday. The schools have sent the letter, and I think it's really important that we communicate with parents because they do feel like they're being a little bit left out. I mean, the 2 issues we're working on are, one, getting some ventilators into the school. One of the issues is with those children, with those procedures. I'm reassured by Public Health that if we can get ventilators in that recycle the air, I think it's up to about 10 times an hour. So these things are very powerful. That can oversee some of the problems. And then the second one we're looking at is what's called face fit mask training, which is where the staff have an air sealed masks. They all have, not just the ones we wear till we go down Tesco's. These are proper medical fit to your face, and they have to have the gels put in, and it's properly fitted. So we're working down that route. The heads are very supportive. We're working with public health. We're working with a range of medical services, and the plan is to get those children back in school within a couple of weeks. I think the delay going forward will possibly be how quickly we can get the ventilators in. There's the cost to find for that. I think we're looking at about £40,000. We've asked the department if they can find the money, but we've definitely got a plan to get those children in, and now we're communicating. I think I've written to the parents 2 or 3 times in the last couple of weeks, so they're reassured. The other question about, you asked about children in schools and special schools. I think what's really important is we get the right children into the right school. I mean, that's the part of the answer. If we genuinely have children that need to be in a special school because they have that level of complexity, then they will be in a special school. But I think the answer really is as well to try and make our mainstream schools more inclusive for the children who they need to be meeting those needs. The answer isn't, in my view, to just keep, and this is the local authorities' view, and I talked to Helen about this, we can't just keep building more capacity because it's a self-defeating prophecy. We need to make some of our mainstream schools take some of these children. Obviously, for the children that genuinely need special school places, rest assured they will be there. But the cost of the borough of running out of places and putting the pupils out of borough. So I've talked about the AGP. Someone asked about the summer provision and children who were on elective home education or from the virtual school. I mean, I think there was a little bit of a crossover on that. Yes, if schools recommended those children, we actually asked the schools themselves to nominate the children for the summer provision. So we actually took the schools' recommendations on the children. I could double check if there were anybody actually on the EHE list. And in terms of the comment about, or the question about contingency plans, one of the things I shared with heads was on the 28th of August, there was some government guidance that came out on a Friday night talking about a tiered response. I'm sure some of you have seen that. And essentially, this is the plan B that everybody was saying ought to have been out a little bit earlier. But there's basically a tiered response of what schools do if we go into certain levels of lockdown, and at what point which tiers and which children go into school. The aim is to keep primary schools open right through until we get to tier 4, which would probably be a full national lockdown. So we're hoping not to get there. Special schools and AP stay open regardless. So they are regarded as vulnerable children and they will stay in school all of the time. It's the secondary sector where it's more complex, and the college sector, because that's driven by the science, as I understand, that those group of youngsters and young people are more likely to transmit the virus. So if we go into tier 2, I'd have to put this on the screen, I haven't got it with me, but I could circulate it if people want to see it. Tier 2 basically means that secondary schools would go into a 2-week in, 2-week out blended model. So it might be, depending on the geography of the school, the head might decide to send certain children from certain areas of the building home for 2 weeks and learn remotely, and other areas they stay in school. You could do a key stage turnaround where key stage 3 stay in while key stage 4 learn remotely. Obviously, the vulnerable and key worker children stay in. If you move into tier 3, then it's essentially key worker and critical, and you just have then selected cohorts. I've asked the DFE what those cohorts would be. Their response would, it would be depending on the time in the year, but my hunch would be it'd probably be priority to the examination groups. You'd probably find the year 11s and 13s. Certainly if I was ahead again, those would be the ones I'd be wanting to keep in at the crucial times of the year. And then tier 4 is a full lockdown. So we go into secondary schools as well, just having key worker and vulnerable children in. So I can get that shared if people would like to see it. It's only my rag, but it's following. If you were to Google the guidance on the 28th of August, that is the tiered response. So that is your contingency plans. In terms of the specific question about supply teachers, under the guidance, supply teachers are allowed in schools. So heads can use supply teachers along with peripatetic staff. On a related issue, one of the things I've also made clear to schools and to my team, or the education team, shouldn't be using the word my, should I, is that we want to have a coordinated response in terms of who goes in. So the guidance we're giving them, and I know heads find it a little bit frustrating at times, but we only want staff going into schools if they're essential to the child's care or the child's access to the curriculum, because we're aware of how hard they've worked to set up their bubbles get their hand sanitizers, you know, all the things you think you're going to have to do when you decide to be
Yeah.
ahead, all the signage, all the one-way systems. We don't want that being messed up by having people in to do training that probably doesn't need to be done and corrupting a bubble, and then we have to send children home. So we're trying to very centrally control what goes into schools. So I hope that's all of the answers.
Yeah, thank you. Christine, did you want to speak again? You've still got your hand up.
Thank you, Anne. I listen to what Jeremy says, and I agree with some of it, but I don't agree with all of it. The schools, the special needs schools, are terribly overgrown with children. There's 4 at Penn's Meadow to 5 with tracheotomies. At Owl Park, there's 14. These children won't go in unless they've got a room of their own and it's isolated for that child. So that means half a day for each one. Can you tell me, when Owl Park was done down the Thorns, how many children it was supposed to take and how many it's got now? And not just with Owl Park, but Penn's Meadow and all the other special schools. Now we have now got more children with special needs than we've ever had, and it's not getting any better. And I would say, yes, we can take a percentage out and put them into mainstream with personal assistance, because we're not solving the problem.
No, I know.
Very
Okay, so
passionate
yeah,
about
to
it.
go back to the AGP issue, Christine. We are working on a solution that doesn't have them in individual rooms. I know Wolverhampton have gone down that route, but we've had long discussions with the heads and they don't feel that's right for the children anyway, to be almost put into isolation. So the solution that we're going down with the ventilation and the training means that those children can effectively still be taught in classes. So there won't be a go in for half a day and that's all you get. Those children will be back in school, and the same with the ones at Penn's Meadow. We're aware they are oversubscribed, they're over pan. I don't have the figures to hand. And obviously, when I talk about children going back into mainstream, I'm not talking about children with the complexity of those children. No one would assess those children go in. I'm talking about the lower complex children from the likes of Sutton and the Briar. We're not going to suddenly put children from Penn's Meadow into Pedmore or something like that. There's no plans to do that. So please be reassured. It would be what's right for the children, Christine. We're not going to have a wholesale, let's get all these children back into mainstream.
It's just the NHS that say that they've got to have a special room. And I would like, if we could get a meeting with our councillors to go to Owl Park and have a walk round and see what fabulous work they do with the children. And some, as you know, with very, very, very complex needs. As people who have never been there, who don't know, haven't got a clue what these children are like and what they have to put up with and what their parents have to put up with. I'm sorry I get in a bit irate, but
fine.
I'm very passionate about these children. I've worked with them for a good many years at home, and it's my biggest passion as they get.
No, that's why I'm so keen to get. Sorry.
And we're putting in children, and we've got oversubscribed children in the. They haven't got elastic walls in these schools. There's only so many rooms that they can change. Sorry.
No, it's all right. I'm as passionate as you are. I mean, I've run a provision with children like that. I've been ahead in a provision like that, so I know exactly how you feel, and that's why we're determined to get these children back in.
Right. Can I call in Helen, please? I think you want to contribute.
Yeah, I think it was just really going on the back of what Jeremy's just said, and just kind of in terms of what Councillor Perks is so passionate about. And I think we all, we're all passionate about doing the right thing for our children with disabilities. We all know, and I think for me, it's just to remind Scrutiny that we had quite a damning SEND inspection May last year, where we've had to completely transform the whole of the SEND framework almost. We've had to take it right back to scratch. Now, I've said and sat at Scrutiny and said that this isn't an overnight job. This is going to take us a few years to repair. We've got a written statement of action, 14 recommendations. That's huge amounts of work that we have to do as an LA. part of that written statement of action is our special economy, our special schools. We do understand the pressures in our special schools, and the fact that you know, a lot of our parents are citing our SLD schools because they're so good. And the minute a parent specifies Old Park or Pensmeadow as a preference and they take us to a tribunal, it takes a lot for us to win those. Hence why the pressure then always goes back to Pensmeadow, Old Park in particular. So we, you know, in terms of what you're saying, Councillor Perks, we're totally with you. We totally agree with you. But this is a journey, and this is a hard journey we're on at the moment. We've had to completely overhaul it, as I've mentioned before, and we'll continue to work hard to get it right, because that's exactly what our children with disabilities deserve. But I have to take you back to the inspection, because what inspectors said was that we weren't aspirational for these children, and we weren't outcome focused. So in reality, we do have to support our mainstream schools to step up around our inclusion agenda, based on what Jeremy said, because these children have got a right to be in mainstream school as well, if that's what they want. So I just felt it was important for me to just put a reminder around that inspection and all the work that we're trying to do in relation to the special schools.
I think as well, if I may, you know, just say my piece, that, you know, we do have issues with our schools that don't want children. They just do. I know I've experienced this myself. We don't want them. Go to a special school. End of. They don't want to be bothered. They don't want to put the work in. We've got to change that mindset. It's like EAG, isn't it? You know, oh well, no, you know, you educate them at home, you know, and then it's off our hands. And that mindset needs to be changed. And a number of councillors this week have had an email from We Love Carers citing, you know, that they're saying that there's poor provision for children with SEND in Dudley. Actually, there's not. I mean, when you look at if you ever watched the Panorama programme on Monday night, good grief, that to me was a real horror story. That was an arm's length company running that, and we are on a journey, as Helen says, you know, and we know that we've got it wrong over the years, but we've got to start now putting it right for future years. One of the recommendations in this report is that members suggest any areas that they wish to scrutinise with respect to support for schools in September 2020. I'm very much aware that, you know, we can only scrutinise so many things during the course of the municipal year, and there have been a few recommendations tonight, but I'm wondering whether, you know, especially with looking at perhaps in depth with one of our working groups, Helen, could be this around the special schools and the support. What if members agree to that?
Yeah,
welcome ideas.
Yeah, we can do that. We can do that, Chair. Yeah, we can make it part of the elective home education conversation.
Yeah, right. Okay then. So if there are no other questions, the recommendations are that members.
Chair, sorry to interrupt. Councillor Sahota had got his hand raised.
It's not showing on my screen at all, Helen.
It's okay. No, it's fine.
Okay then, Councillor Sahota, please.
You're on mute, Councillor.
I'm sorry. Let's take two. I just want to thank Jeremy for the detailed report, really, which basically outlined wide-ranging activities obviously being delivered for Dudley children over the summer period, obviously working with a number of key partners. Just an observation, really, from the report, Jeremy. Obviously, we only had 6 primary schools who offered activities for schools. And when you look at the actual geographical locations of these, 3 were in Housekeeping, 1 was in Amblecote, 1 was in Dudley Town Central. So there wasn't any other primary schools open in central Dudley or the north. So is that a concern to us in terms of making sure schools are open across the borough rather than just in
I think, Councillor, to be honest, I did touch on that, maybe not in enough depth. It was all to do with the fact that we couldn't get enough clarity from the department around how we might be able to fund them. The schools that went ahead funded themselves pretty much, and a lot of the sports provision that I talked about would have been parents actually funding for their children to go. If we'd have been able to access more funding, we would have supported that, and we would have had more extensive DPA provision, Dudley Performing Arts. So it was really just schools that were able to go ahead and fund themselves.
And I think there lies a question, really, because if you look at the schools, a lot of these are actually in middle class affluent areas. So then there's a question that, you know, what can we do as a local authority to ensure schools that do need the support in the private wards when it's all red, how can we support them going forward?
Yeah, I mean, the reason I've just explained was all around the finances. It shouldn't come down to that. Morally, that's wrong, isn't it? Particularly with our more deprived communities. But essentially, what the rollout of the money that the government proposed, this was what was originally called catch-up funding, and then got more widely distributed. Essentially, the schools would get an allocation in 3 termly tranches across the year. So if schools decided to use it for their summer provision, they wouldn't get it for other things. So some of the heads, I think, knowing that, made the decision, actually, we can use it, because I think some of the schools would have got sums around 18, 20,000 pounds, which sounds quite a lot. But when you translate that into staffing, I mean, our DPA provision for 2 weeks costs 20,000 pounds. So you can either have 2 weeks of summer provision and lots of interesting activities, or you can probably do some more curriculum directed. I'm assuming that's, I didn't make those decisions because I'm not a head anymore, but as a head, I'd have probably said, actually, do you know what, I'll wait until term starts and I'll hire an extra learning mentor, or I'll get some part-time maths teachers in and supplement the curriculum. I think that's some of the decisions. They couldn't have the money twice, basically.
Okay, thank you for clarifying that. Thank you.
Right, thank you very much then for a very concise report, and if you could pass on the thanks of the Scrutiny Committee, Jeremy, to everyone involved, because it's a very positive report. So thank you very much indeed. The recommendations are that members note the content of the
Sorry,
report.
Chair. Sorry again to interrupt. Councillor Ridney has her hand raised as well now.
Right. Yeah. I'm not seeing anybody. Thank you.
Okay.
Thank you,
Right,
Chair.
so-
I only really wanted to support what Jeremy's been saying, because there was a comment made there was none in the north of the borough. We had worked earlier in the year on a programme to provide clubs during the summer, but it was in partnership with some of the voluntary organisations, and because everything shut down, it wasn't able to go ahead, really. So there were plans that had been made to put them in, but because of the particular restrictions, it wasn't able to go ahead, and that was schools working with the authority as well. So it just really wasn't able to happen because of the pandemic.
Thank you. So, Helen, before I go for the third retake.
You're safe now. You're safe.
Right, okay. So, recommendations are, for the third time, members note the content of the report, that members suggest any areas they may wish to scrutinise with respect to support for schools in September 2020, which we've brought up the fact we're going to include the special schools in with the EHE. So is everyone in agreement with that?
Yes.
Okay, that's carried then. So we now move to item, hang on, it's all right, they're all out of sync. Item number 10, to consider any questions from members to the chair where 2 clear days notice has been given to the monitoring officer. Council Procedure Rule 11.8.
There are none, Chair.
Right, thank you very much indeed. So I will now be calling the meeting to a close, but could I ask Helen and Kim to stay online? Thank you very much, everyone. Good meeting, and I'll see you at the next one.
Thank you, everybody. Thank you very much.
Thank you.
Thank you.
Bye.
Bye.
Anne, can I just double check? You know, when you said Helen, did you mean